they start?
Okay, so
I'm just jumping here quick.
so basically, it's red pulp and white pulp. All
Yeah.
right.
Got it.
Connective tissue trabecula. There. And you often see blood vessels associated with it. And then, so here would be a connective tissue trabecula, and here's one too. And this is just where the white pulp is beginning to associate. So we're leaving a trabeculum and going into a central artery. So think of so this is actually a funny branch point.
Is that a cross section of the trabecula?
Well, like I said, you're going to find every bloody section in the universe here. So let's say this is a connective tissue. Sorry. Here's a connective tissue trabeculum. Here's a little arteriole or artery. So leaving the trabecular artery, it's going to branch off and become associated with that periarteriolar sheath. So you could call this or this central artery, even though they may or may not be central. Same kind of thing here. So who knows really what the actual plane extension is. And then, so this would be, well, I'm looking for here's the germinal center. So there's the central artery. This whole thing from here to here is the periarteriolar sheath, and this is the germinal center.
That's a better plane. That's a nice plane.
Right. So that works out there. You have bigger vessels and smaller vessels. You never can tell what's going to happen in here.
So
well, this one has got a lot of connective tissue in it, so it's probably better to call it trabecular.
Okay.
Yeah. So
You're the terminal.
This would be a central artery. Okay? So then when you get out here, you need to use your fine focus, sort of up and down, and realize that there are blood vessels like this. Remember that funny scanning EM that showed the little barrel staves? I showed you a picture. You can see sort of lines of erythrocytes running along. Here's a blood vessel right here.
Oh, I see it.
You see it there?
Yeah.
There it's all crammed together. Here's a blood vessel right here. So you see the erythrocytes in there. But the confusing thing is that there's erythrocytes jumbled up in the rest of the tissue. So all of that together is collectively, it's a mess. It's collectively called red pulp. And so it's been partly drained out here. So you sort of see some blood vessels along here.
Fenestrated
This is where you'd actually see fenestrae. And you've got to keep using funny focus to sort of imagine the little holes in there. It's really hard to tell what's going on. And so there's some controversy still, but nobody wants to touch it because it's not really a big point anymore. Is it an open circulation, closed circulation? You can see examples of both in almost every critter. So just imagine there are sinusoids here, but the red blood cells are not just confined to them. So this would be a sinusoid right here. But what's that red blood cell doing? It's out in the periphery. And so most of the cells around it are, in fact, macrophages. Okay? So so I want to run other people through this same sort of stuff.